Bismillahirrahmanirrahim. I am Dr Muneeb Altaf, and today I am going to discuss about polio under the supervision of Professor Dr Saira Afzal. So, what is polio? Polio or poliomyelitis is a highly infectious viral disease that largely affects children under the 5 years of age and caused by the polio virus. Polio virus is transmitted by person to person, and it's spread mainly through fecal route or less frequently by a common vehicle, contaminated water or food, and it multiplies in the intestine from where it can invade the nervous system and cause paralysis. So serotypes. Spherical virion with a single stranded RNA, and it has three serotypes: one, two, and three. One is Bernheim and Mahoney strains. It's of type one. Lansing and MEF1, it's type 2, and Leon and Soke is the type 3. How the polio virus get resistance. So the polio virus is resistant to ether, chloroform, bile, intestinal, proteolytic enzymes, and detergents, and it is stable at the pH of 3, and it can survive at minus 20 degrees centigrade for 4 years, 4 degrees centigrade for months, and at room temperature for 1 day to several weeks. And it is inactivated by heat, formaldehyde, ultraviolet light, chlorination, organic matter in water delay the activation by chlorination. Pathogenesis by fecal route through the ingestion, and droplets from the patients with the early disease can enter through inhalation or through conjunctiva, and replication occurs in the epithelial cell of GI tract and the local lymphatics. In this diagram you can see there's a entrance of the virus and local in the local lymphatics of GIT, and then goes to the circulation, and then it goes to the reticuloendothelial system. From reticuloendothelial system it goes to circulatory system, major or secondary viremia it is called, and then it finally goes to the spinal cord or brain to cause a paralysis. Effects on the CNS. It multiplies in the neuron and destroys them. The earliest changes are the degeneration of the nasal bodies, followed by nuclear changes and finally neuronal death. And in the spinal cord, lesions are mostly in the anterior horn, causing flaccid paralysis. And in the posterior horn, and intermediate column may also be involved. Epidemiology. So reservoir is human, and transmission fecal route, oral possible, and communicability 7 to 10 days before and after the onset of the virus, and it present in the stool after the 3 to 6 week of infection. So what are the types of polio? It's asymptomatic polio, non-paralytic polio, paralytic polio, and paralytic polio is further divided into three types: spinal polio, bulbar polio, or bulbospinal polio. Asymptomatic polio, it accounts for approximately 95% of the cases, and virus stays in the intestinal tract and does not attack the nerves. Virus is shed in the stool, so infected individual is still able to infect the others. Non-paralytic polio, uh, abortive poliomyelitis, and it does not lead to the paralysis. Mild symptoms seen such as sore throat, fever, nausea, vomiting, diarrhea, and constipation. And these are the minor illness, and major recover. Mostly, it recovers in less than 1 week. Non-paralytic aseptic meningitis, it is a major illness in the non-paralytic polio, and it occurs in 1 to 2% of the polio infection. Symptoms are stiffness in the neck, back, and leg, increase sorry, Increase or abnormal sensation can occur and complete recovery after 2 to 10 days of the symptoms. Now, paralytic polio. It's fewer than 1% of those infected develop this type of acute flaccid, this type of polio, and acute flaccid paralysis is seen. Initially focal but spread over 3 to 4 days, headache, neck and back stiffness, unusual sensation, increased sensitivity to touch, droplet sign, and descending paralysis, asymmetrical patchy paralysis, and deep tendon reflex lost before the onset of paralysis. Spinal polio, most common form of paralytic polio. It is 79% attack on the motor neuron and causes the paralysis of the muscle of respiration and muscle of extremities. And children less than 5 years most likely to become paralyzed in one leg. Adults are most commonly paralyzed in both arms and legs, and those affected still retain the sensation in extremities. Bulbar polio accounts for 2% of the paralytic polio. Virus attacks the motor neuron in the brainstem, affects the cranial nerve functions, and primarily inhibits the ability to breathe, speak, and swallow effectively. Bulbospinal polio accounts for 19% of the paralytic cases and affects extremities and cranial nerves, and it leads to severe respiratory involvement. Paralytic polio risk factor. Risk factor for the paralytic polio are compromised immune system, pregnancy, mouth or throat surgery, injury or strenuous physical exercise after the exposure to virus. Now, treatment. There is no cure for polio. It can only be prevented by immunization. Treatment for polio focus on limiting and alleviating the symptoms. Heat and physical therapy can be used to stimulate the muscles, and antispasmodic drugs can be used to relax the affected muscle. This can improve mobility but does not reverse the permanent polio paralysis. Post polio syndrome, it can occur in 25% of the individual decades after recovering from the acute infection, and its feature include the muscle weakness, extreme fatigue, or paralysis due to failure of oversized motor units created during recovery from paralytic disease. Stats. So, wild polio virus cases have decreased by over 99% since 1988, from an estimated 350,000 cases in more than 125 endemic countries to 6 reported cases in 2021. Of the three strains of wild polio virus type 1, 2, and 3, wild polio virus type 2 was eradicated in 1999. Wild polio virus type 3 was eradicated in 2020. As at 2022, endemic world polio virus type 1 remains in two countries, Pakistan and Afghanistan. So this is in this graph, you can see the wild polio virus 1 and vaccine derived polio virus in Pakistan. These are the cases on the x-axis, on the y-axis, and the years on the x-axis. This data is of between 2015 to 2021. You can see in the diagram that in 2019 the wild polio virus cases was 140, and in 2020 it decreases to 80, and again the vaccine drive polio virus type 2 was in 2019 it was 20, and in 2020 it increases to 120. But now again in the 2021 the value of both wild polio virus 1 and vaccine drive polio virus 2 are less than 20. So in this picture, you can see the up till now in the 2023, the wild polio virus cases which are reported in Pakistan is only one. So, global prevention programs. In 1988, the World Health Assembly passed a resolution to eradicate polio to achieve its permanent reduction to zero with no risk of reintroduction. And in the same year, the Global Polio Eradication Initiative was launched. Prevention programs of Pakistan. The National Emergency Action Plan is the annual document that outlines the eradication strategy of the program and its strategic priorities. The program is currently implementing the National Emergency Action Plans for Polio Eradication 2020. As per NEAP 2020, the program is committed to stopping all the wild poliovirus type 1 and vaccine-derived poliovirus type 2 transmission in Pakistan. So to achieve the goals of NEAP, the program is focused on ensuring the following objectives: stopping the poliovirus transmission in all remaining wild poliovirus 1 reservoir, rapidly detecting, containing, and eliminating all the poliovirus from any newly infected area, and the creation of a new area of work which concentrates on the building synergy with the expanded program of immunization, that is EPI of Pakistan. Uh, Through this area of work, Pakistan hopes to improve the essential immunization coverage of the child while addressing broader health needs through the provision of expanded package comprised of health, nutrition, and wash services. Polio vaccination. So vaccination was discovered, that is initially in 1955, inactivated vaccine in 1961, type 1 and type 2 monovalent oral polio vaccine. In 1962, type 3 monovalent OPV was discovered, and in 1963 trivalent OPV, and in 1987 enhanced potency IPV infectious polio virus was discovered. Inactivated polio vaccine. It was developed in 1952 by Jonas Salk and contains three serotype of vaccine virus: 40 units of one, 8 units of two, and 32 units of three. It was grown on the monkey kidney cells, inactivated with the formaldehyde, and it contains traces of 2-phenoxyethanol, neomycin, streptomycin, and polymyxin B, and is safe in immunocompromised and in pregnancy. Heat stable at the room temperature but should be refrigerated to preserve the potency. Highly effective in producing immunity to poliovirus. More than 90% immune after 2 doses, and uh, more than 99% immune after 3 doses. Humoral immunity, and to some extent pharyngeal immunity. So the duration of immunity not known with certainty. Oral polio vaccine discovered by Albert Sabin and contains three serotypes of vaccine virus. It's 3 lakh TCID 50 of type 1 lakh TCID 50 of type 2, and 3 lakh TCID, that is of 50 of type 3. And it was again grown on monkey kidney cells, and it contains neomycin and streptomycin. The oral polio vaccine produces both humoral and local immunity, and it also contributes to herd immunity. 50% immune, and the patient get 50% immune after 1 dose, and it get more than 95% immune after 3 doses, and immunity probably lifelong. And heat label, it's minus 20 degrees centigrade, can be stabilized by adding magnesium chloride, and it should not be frozen and thawed repeatedly. So the adverse reaction of the vaccine, the polio virus adverse reaction of these are rare local infection by the injectable polio virus vaccine. No serious reaction to IPV has been documented, and paralytic poliomyelitis due to the oral polio vaccine. Polio vaccine contraindication. So, severe allergic reaction to a vaccine component or following a prior dose of vaccine can be a contraindicated, and moderate to severe acute illness can be a contraindicated. Vaccine associated paralytic polio. So, the mutation of a vaccine inside the body may cause loss of attenuation itself brought on by reversion and leads to paralytic polio. Increased risk in the person more than 18 years and those with immunodeficiency, especially of B cell. Vaccine derived paralytic polio virus. These virus, like those causing vaccine associated paralytic polio, are neurovirulent but additionally are transmissible and capable of causing outbreaks. They have been classified into three groups: circulating vaccine derived paralytic polio virus, and VDPV in the immunodeficient, IVDPV, and vaccine derived poliovirus of ambiguous origin, AVDPV. So, risk factor of outbreaks due to circulating vaccine derived poliovirus includes dropping the immunization coverage, high population and densities, and tropical conditions, and previous eradication of wild virus. Administration of the OPV, oral polio vaccine. 2 drops of the OPV is used. Nose should not be pinched. Instead, apply the pressure to both sides of the mouth of the child. And breastfeeding is not contraindicated after the administration, and hot liquid to be avoided from half hour after the OPV. Now, the transmission that majorly include the cold chain. So, what is cold chain? The system of transporting, storing, and distributing the vaccine in a potent state at a recommended temperature till it is administered to an individual. If cold chain is not maintained from the manufacturer to the place of vaccination, the vaccine efficacy greatly suffers. Most vaccines lose their potency by heat and sunlight, and hence need protection from both. Now, the equipments for the cold chain. So firstly, walk in cold room, 3 months, and serve district. Second one is the deep freezer, that is of 300 liter, and ice lined refrigerator. Deep freezer are used for making ice packs and to store the OPV and measles vaccine. And small deep freezer of 140 liter, and cold boxes which are for the peripheral center, mainly for transportation. The vaccine carrier used to carry small quantities of vaccine, like 16 to 20 vials for the out of the reach session, and ice packs. So, vaccine while monitoring. The vaccine vial monitor is a small thermochromic sticker on the vaccine vial, and changes color as the vaccine is exposed to the heat. So, the color of the sticker tells whether the vaccine must be discarded due to excessive heat exposure, or it should not be, and it reduces the uncertainty and the waste. So this is the picture of the vaccine. In this picture, you can see at the center there is a black hole, and inside there is a square which is of the thermochromic material. And by the exposure of light and heat, this inside center, the color of this square can change, and if it is white at the start, then it's as you can see in the start, then it's normal and the vaccine can be used. And if this color changes to black, then it's this vaccine cannot be used. Now it's time for the recent updates. So this was the article, a novel tool to eradicate an ancient surge. The novel oral polio vaccine type 2 story, and it was published in 2022 in the Lancet. And in this article, they said that to address the risk of circulating vaccine derived polio virus, a global collaborative effort over the past decade has enabled the development of novel oral polio vaccine type 2. This is immunogenic as the current 7 strain and so equally effective while being less likely to revert to neurovirulence than the 7 oral polio vaccine. The successful development of novel oral OPV2 vaccine, the first such vaccine against type 2 polio virus and first vaccine ever authorized by the WHO pre-qualification team through its emergency use listing procedure, has led to the development of approximately 450 million doses of novel oral OPV2 of outbreak control in 21 countries. So, monitoring the use of novel OPV2 has confirmed that it is more genetically stable and less likely to result in vaccine derived polio virus disease than the 7 strain. Now it's the MCQs. So number one, alert has been issued by the authorities regarding the contaminated water in Swat KPK. District Health Officer has mobilized the vaccination team of polio. What can be the most common way of transmission of polio virus in the late disease? A is fecal-oral, B is respiratory droplet, C is IV transmission, D is by skin to skin contact, E is by vertical transmission.
A.
Yes, alpha is the right answer. Most common in the late disease is the fecal. Question number two. Poliomyelitis or polio is a highly infectious viral disease that largely affects the children under the 5 years of age and caused by the poliovirus. After entering into the body, what is the replication site of poliovirus? Number A is eye, B is oral mucosa, C is circular muscles of esophagus, D is mucosa of stomach, and E is local lymphatics of intestine.
E.
E is the right answer. Local lymphatics has a replication of the poliovirus. Question number three. Poliovirus is resistant to proteolytic enzymes of intestine, and 95% of the poliovirus infection is asymptomatic. But this patient can still pass the virus in the stool. So, what is the duration after which virus can still can present in the stool after the infection? Number A is 1 to 2 weeks, B is 2 to 3 weeks, C is 4 to 5 weeks, D is within 1 week, and E is 5 to 6 weeks.
D.
Beta is the right answer. After the infection, after the 2 to 3 weeks of infection, the patient, the virus can present in the stool. Question number four. A 5-year-old boy of KPK presented in the OPD with a complaint of difficulty in speaking, breathing, and swallowing. Doctors suspect the polio after the history and examination. So, what is the type of polio that this patient is having? Number A is asymptomatic polio, B is non-paralytic polio, C is spinal polio, B is bulbar polio, and E is spinobulbar polio.
D.
Delta is the right answer. The bulbar polio, which affects the cranial nerve, so that is the why that and the patient is having difficulty in speaking, breathing, and swallowing. So bulbar polio, delta is the right answer. Question number five. In 1988, the World Health Assembly passed a resolution to eradicate polio. To achieve its permanent reduction to polio to zero with no risk of reintroduction. In the same year, which one of the following program was launched by the WHO? A is Global Polio Eradication Initiative, B is EPI, C is National Emergency Action Plan, D is Global Action Plan, and E is Pulse Polio Immunization.
A.
Alpha is the right answer. The Global Polio Eradication Initiative. Question number 6. Wild polio virus cases has decreased by over 99% since 1988, from an estimated of 350,000 cases in more than 125 endemic countries to 6 reported cases in 2021. Which one of the following strain of polio virus is still present in Pakistan? Wild polio virus type 2, wild polio virus type 1, wild polio virus type 3, vaccine dry polio virus 3, vaccine dry polio virus 4. The answer is B. Wild polio virus 1 is still present in the Pakistan. Question number 7. Oral polio vaccine is one of the best way of prevention of poliomyelitis. After how many doses a patient can become more than 95% immune? A is after test dose, B is after one dose, C is after second dose, and D is after third dose. So the answer is delta. After third dose, more than 95% the patient will become immune to disease. Question number 8. Inactivated polio vaccine is developed in 1952 by John Salk. It contains three serotype of vaccine virus and grown on monkey kidney cells. Which one of the following is which one of the following material is used to inactivate this inactivated polio vaccine? Number A is ethanol, B is methanol, C is formaldehyde, D is chlorine, and E is laser.
C.
Charlie is the right answer. Formaldehyde is used to inactivate this inactivated polio vaccine. Question number 9. Pakistan and Afghanistan are now the only polio endemic countries of the world. How many cases of the wild polio has been reported in Pakistan in 2023 till now? The answer is
B.
E. Only one cases has been reported in 2023 till now. Question number 10. According to new research, development of novel oral polio vaccine type 2 that is immunogenic as the current 7 strain and so equally effective while being less likely to revert to neurovirulence than the 7 oral polio vaccine. So which one of the following property make it more reliable than the 7? A is genetically less stable, B is genetically more stable, C is more heat stable, D is less heat stable, and E is less efficacy.
B.
B is the right answer. Genetically more stable, that is the property which enhances the um, oral novel Oreo polio vaccine type 2. This is the key. This is the our YouTube link channel. Please like and subscribe, and thank you. Dr. Sadia, can I end the meeting?
G. Dr. Muneeb, thank you so much. Allah Hafiz.
Okay, thank you.